Good evening, everyone.
Good evening, ma'am.
Good evening, ma'am.
Okay, so today we'll start with the clinical trial design. Okay, so let's wait for a couple of minutes. People are joining till then. Okay. Last class, any confusion, any doubt you have from the last session? No? Okay, so just give me a couple of minutes so people are joining because. Okay, my screen is visible to everyone.
Yes, ma'am.
Yes, ma'am.
Okay, okay. So let's start with clinical trial design. So when we talk about design, so whenever you want to implement anything, okay, wherever you work or we say in the clinical research, you want to have like we are conducting a trial, we give a interventions or standard drug or placebo. So there are some patterns which has to be followed. Okay, although it is mentioned in the protocol, ki this crossover of pattern or this observational study, everything is mentioned over there, but you have basically you have to understand ki what is the clinical trial design. Okay. So the clinical trial design methods used on the basis of awareness. Okay. Awareness in participants, like we are conducting observation study. For that, you can implement the clinical trial design based on that. Then on the basis of magnitude of activity, so to find the better treatment, okay, the current treatment is better or not, or we do certain experiment with the new drug as compared to the already accepted one. Okay, so some patterns or some designs are there in that. Okay, so the clinical trial design method used for randomized control trial and non-randomized control trial. When we say randomized, so randomly we have to allocate the subject into different group. Okay, like we have parallel study over there, we have crossover, we have withdrawal trial design, we have factorial design. Okay, so we'll see all this. Whereas non-randomized means based on their, you have to check the history of illness, okay, the prospective analysis we call, or we can say the historical control. Taking that historical data or historical illness, taking that consideration, the patient and are given the drug. Okay, okay, how much the drug effect is there. So basically, it is specific to the selected participants or selected patient. Okay, non-randomized. Because it is like a non-randomized, you should have a subject over there. Okay, so it could be a limited number. So you cannot do the randomization. They know ki what drug I am getting, what treatment I am getting. So all that these things we will see in detail. Okay. Now, wherever you find it difficulty, please ask. Okay, because it is a very important. You have to understand the clinical trial design, right? So why do we do a clinical trial? To get an answers. We have a clinical problem to test the hypothesis. So when we develop a drug, okay, so it becomes a hypothesis कि yes, the drug will be affecting a particular region or not, right? So that becomes a hypothesis. To prove that, we conduct certain kind of design, certain kind of analysis we do with the drug. Okay, we do the phase one, phase two, phase three study we do, right? So to get the answer, we conduct a clinical trial. To gain a knowledge about a new or established treatment, to support a claim. If any company is claiming that this drug is helping in the particular disease, this drug is or device is very much evolved one, very advanced one. To prove that, we have to get a data for that. Okay, prove the claim. So we have to do a clinical trial. Now, what is a trial? It is a tool for testing a drug, device, or technique, whether it is effective, whether it is safe enough or not. Right? Now, how to design a clinical trial? So, it starts with a hypothesis. First, you have to do the analysis ki whether what hypothesis one means, what endpoints I am going to expect from out of this, out of the trials. Okay. Based on that, we have to conduct a study. We will conduct a study. We will generate a data whatever the objective aim we have taken. So we have to take a data out of it, and then we have to choose ki, yes, this will be our primary endpoint, this will be our secondary endpoints, and we will measure that, right? Now, type of clinical trial. So, whenever someone asks you what are the clinical trial is being classified, so it is always classified into observation study and intervention study. Okay, it is classification, observation and intervention. Observation means investigator is just observing the subject. They measure their outcome, how much the risk they are. They measure that risk and outcome. They measure it. Okay, and the researchers do not actively manage the experiment. These are called natural experiments based on the questionnaire, based upon the survey. We conduct this observation study. Okay. Whereas intervention study, so name suggests intervention means you are giving some drug, you are giving some therapies, you are giving uh, some treatment to the patient, and you are measuring the outcome. Whether you are comparing the particular with the drug with the standard, or you are checking whether the my standard drug how much it is applicable with the other disease condition. So we have to give the intervention to the subject, right? Then the research measures how the subject's health changes according to that. That becomes a intervention study. Okay. Now, types of clinical trials. So they basically have five types of clinical trials. Okay. My voice is audible to everyone? Yes? Hello?
Yes, ma'am.
Yes,
Yes,
Okay,
ma'am.
ma'am.
okay, okay.
Yes, ma'am.
So basically, we have five types of clinical trial. This is important thing. Okay, this is important. Can say interview question kind of thing. If how many types of trials we have, clinical trials. So basically, we have five types of clinical trial. First is your prevention trial. So any medicines or any kind of vaccines or any kind of trials we are doing, which changes or we can say we prevent the disease who have never had the disease or we want that this disease should not come back. Okay, so such kind of trial are come under the prevention means you're taking the preventive actions. Okay, so like developing of vaccines, any kind of medicines for the prevention, any kind of vitamins or lifestyle changes, they all will come under the preventive trials. Okay, then we had screening trials. So we can take an example of like cancerous cell. We have to study that. We have to screen that. Ki how much this the patient is at what stage, at what level his this disease has been spread. Okay. So for that screening we are doing. So all the tests based upon the detection of certain disease or certain health conditions will come under the screening trial. Okay. Now, next is your diagnostic trial. We have to find a better test or procedures for the diagnostic of particular disease or a condition. We have a diagnostic kits, right? We have ECG machine or any kind of X-rays or sonography. Everything will come under the diagnostic trial. Okay? We are diagnosing the disease. We are seeing how the better way we can test the particular disease. Okay? Next is your treatment trial. So when we conduct a experimental design. We give some standard. We compare with our new drug. We give our placebo and check how our drug is acting on it. So this is a kind of a treatment trial. We are treating the subject with that. Okay, we find a new approaches to treat the patient with a particular disease. Okay, whether it is drug, whether it is device, whether it is surgery, whether it is radiotherapy, any kind of therapy, all will lie under the treatment trial. Okay. Last is the fifth one is your quality of life trial. So it is kind of a supportive care we trial which we give to the chronic illness patient to comfort his life. Like if he's suffering from any kind of chronic disease and he's getting under the medication, he have certain discomfort with the development with the particular therapies, a particular drug to support that, to cure them, to make this improve the comfort level. We conduct certain quality of life trial. Okay, whether it could be from based on the food, like changing the food, okay, or giving certain medicines which will be good for his health. Okay, so such kind of trial will come lie under the quality of life trial. So there are five types of clinical trials, so don't get confused in phases, in types, in categories. Okay, the three are different things. Now coming to the this randomized control trial, first we have parallel designs. Okay, so all the designs will study by the help of a diagram. It will be easy for you to understand. Yes, what happened? What was that? Yes, Khushi. Just ओके खुशी को क्या आपको नहीं समझ में आया है
Five types, ma'am.
फाइव टाइप्स
Clinical
देखो
trials.
ठीक
हाँ.
है ठीक है ठीक है ठीक है ठीक है ऐसा कुछ रहता है ना एनी वन ऑफ यू कि हिंदी में चाहिए तो आई विल एक्सप्लेन यू हिंदी आल्सो बिकॉज सी दिस इज इंपॉर्टेंट थिंग सो फाइव टाइप्स देखो कैटेगरीज क्या रहते हैं अपने दो कैटेगरीज रहते हैं ओके ऑब्जर्वेशन स्टडी मतलब हम कोई इंटरवेंशन किसी पेशेंट्स को नहीं दे रहे हैं हम ऑब्जर्वेशन स्टडी कर रहे हैं लाइक कोहॉर्ट स्टडी हमने देखा था हमने ये रिट्रोस्पेक्टिव स्टडी देखा है राइट हमने प्रोस्पेक्टिव स्टडी देखा है दिस ऑल कम्स अंडर द ऑब्जर्वेशन स्टडी उसके बाद हमारा फाइव टाइप्स मतलब हमारा जो रिसर्च होता है कोई भी आप ड्रग डेवलप कर रहे हो या वैक्सीन डेवलप कर रहे हो ओके वो किस कैटेगरी में आपका लाइक कर रहा है दैट बिकम्स योर टाइप ओके पहला आ गया आपका प्रिवेंशन मतलब हम प्रिवेंटिव लाइक हमने कोविड का वैक्सीन सो इट वाज अ काइंड ऑफ प्रिवेंटिव वैक्सीन ठीक है प्रिवेंटिव वैक्सीन था वो ओके विटामिन ए का हमको या विटामिन कोई भी ट्रायल हम कर रहे हैं विटामिन का या मिनरल्स का कि प्रिवेंट करने के लिए कि ये डिजीज फ्यूचर में चल के नहीं हो ओके लाइक विटामिन का वैक्सीन हम सॉरी विटामिन का डोज हम लोग बच्चों को देते हैं टाइम टू टाइम स्मॉल किड्स गेट दैट dose for vitamin A, that vitamin A. Okay, so that is a prevention कि हम प्रिवेंट कर रहे हैं कि कोई डिजीज फ्यूचर में चल के नहीं हो विटामिन ए की कमी नहीं हो उनको ठीक है कि हम लाइफ स्टाइल चेंज करके सो जो भी हम प्रिवेंट कर रहे हैं डिजीज को रिटर्न नहीं होने के लिए या कभी ये डिजीज वापस नहीं हो दैट विल कम अंडर द प्रिवेंटिव ट्रायल ठीक है अंडरस्टूड खुशी
Yes, ma'am.
सेकंड आपके आ गया स्क्रीनिंग ट्रायल अच्छा हम कोई भी क्रॉनिक डिजीज हमको डायग्नोस नहीं हमें देखना है सर्टेन कंडीशंस हम उसको कैसे बेस्ट वे से ट्रीट कर सकते हैं जैसे कैंसर का कुछ होता है स्क्रीनिंग करने के लिए कि ये सब उसमें देख रहे हैं स्क्रीन आउट कर रहे हैं कितना वो इन्फेक्शन उसका स्प्रेड हो गया है ठीक है जो भी आपका स्क्रीनिंग जो भी आपका डिवाइस है या कोई स्क्रीनिंग मेथडोलॉजी है पर्टिकुलर डिजीज और पर्टिकुलर हेल्थ कंडीशन को मेजर करने के लिए दैट विल कम अंडर द स्क्रीनिंग ट्रायल ठीक है नेक्स्ट आता है आपका डायग्नोस्टिक तो जितने भी डायग्नोस्टिक किट्स होते हैं ओके और डायग्नोस्टिक के प्रोसीजर्स कि हम टेस्ट करें कि कितना लाइक हाँ सेम कोविड के टाइम में देर वॉज डायग्नोस्टिक किट्स डायग्नोस की कितना किसको इन्फेक्शन है किसको नहीं है ओके सो दैट वाज अ डायग्नोस्टिक ट्रायल तो वो डायग्नोस्टिक ट्रायल के अंदर आता है ठीक है नेक्स्ट आता है आपका ट्रीटमेंट ट्रायल ट्रीटमेंट मतलब हम किसी चीज को ट्रीट कर रहे हैं ओके वेदर इट इज न्यू ड्रग और द सर्जरी और कोई भी थेरेपी हम पेशेंट को ट्रीट कर रहे हैं तो हमको सर्टेन एक्सपेरिमेंट कंडक्ट करना एक्सपेरिमेंटल डिजाइन फॉलो करना है न्यू कॉम्बिनेशन ऑफ ड्रग का हो गया न्यू अप्रोचेस हो गया सर्जिकल मेथड्स के एनी काइंड ऑफ न्यू ट्रीटमेंट हो गया सब वो ट्रीटमेंट ट्रायल में आएगा उसके बाद क्वालिटी ऑफ लाइफ ट्रायल में क्या आएगा कि हम पर्टिकुलर पेशेंट को कैसे कंफर्ट दे रहे हैं कि वो अपने कोई भी, आपने देखा होगा क्रॉनिक इलनेस वाला पेशेंट है, ओके, अब उसको क्या हो गया है कि ऑलरेडी वो मेडिकेशंस में है या ड्रग्स पे है, तो ही माइट हैव अ डिस्कम्फर्ट विद पर्टिकुलर ड्रग्स और डिस्कम्फर्ट विद पर्टिकुलर थेरेपी, ओके। बहुत सारा सीवियर होता है, एलर्जी हो जाएगी या उसको बर्निंग इफेक्ट फील हो रहा है, ओके। तो उसको आप कंफर्ट कैसे फील करवा रहे हो, मतलब सपोर्टिव केयर कैसे दे रहे हो, तो उसमें भी आता है कि आपका फूड, आप उसको पर्टिकुलर फूड दे रहे हैं, ओके, पर्टिकुलर एनवायरनमेंट दे रहे हैं, या पर्टिकुलर कोई ऐसा विटामिन या कोई पर्टिकुलर ड्रग है जिससे उसका ये उसको थोड़ा सा बेटर फील हो, उसको कंफर्ट फील हो अपने, तो उसकी लाइफ जो होगी, क्वालिटी ऑफ लाइफ थोड़ी सी बेटर होगी, थोड़ी इजी हो जाएगी। तो ऐसे सच सच काइंड ऑफ ट्रायल्स सब क्वालिटी ऑफ लाइफ ऑफ ट्रायल में आएंगे, ठीक है, ओके।
Yes, ma'am. Thank you.
Okay. Now we'll see the randomized control trial. The first is your parallel study. Parallel means parallelly you are giving a drug. So first you will be screening the subject. हम screen करेंगे subject को. Then we will be randomizing. Means we will be, क्या होता है when you go for the informed consent process. Okay. After informed consent process, like suppose you required only 50 people and there are 200 people in your for the trial. You have to screen out based upon your inclusion criteria and exclusion criteria. Okay. Then the people who are like 50 people you have screened out, yes, these people will further go for the studies. Then you will be randomizing them, means you are by picking up the chits or by flipping up the coins. So you will be randomly allocating them into different groups. Okay. So in parallel design, we have two, we will be dividing into them two. One group will get a treatment, other will get a B treatment. Okay. And their outcomes will be studied, that it becomes your parallel studies. Okay, like A group you have given a test drug, and B group you have given a standard drug or a placebo, and then you can compare how which patient felt better. Okay, so this become your parallel studies. Understood? Yes or no?
Yes, ma'am.
Yes, ma'am.
Khushi?
Yes, ma'am.
Okay. Whenever you feel ki yes, you are not understanding, you want explanation in Hindi, so please tell me. Just unmute your mic and tell me, because I have to just minimize my screen. Okay. It's for everyone, because okay, it's for everyone, because I can explain in Hindi and English, but not in other language. So you can just, wherever you find it difficult, you can ask. Now crossover. So crossover we'll see with the help of a diagram. Okay. Okay. Are you able to see the diagram? Yes or no?
No, ma'am.
No, ma'am.
No, ma'am.
No,
No.
ma'am.
Okay. Okay.
No, no,
Just
no.
okay. Just wait. Actually, I have done some other settings, so that's why. Just wait. Now you will be able to see. Now you are able to see?
Yes,
Yes, ma'am.
ma'am.
Yes? Okay. So similarly, we will be we have taken the sample, and then we will be randomized into the same group, like two group we have taken, group 1 and group 2. Group 1 has got a medication, or you can say a treatment A, other group has got a treatment B. Okay, suppose you are doing some two drug you have, or one standard and one test drug you have given one medication to one group and other medication to other group. Okay, at certain period of time there will be a washout period. Okay, now in washout period is what, there will be no medication to given, no medication will given to this two group of patients. Okay, now why? So that they can come into their original state. Okay, and after that the patient who have got a medication A, they will receive a medication B, and B will receive a A. Okay, we will take an example, like there are certain medication for osteoporosis. Okay, now they are, this two group are getting a medication. Okay, at certain period of time their medication will stop so as they should come at their original state of their disease. Okay, then only you can give medication other like you can switch over the medication and you can find out which medication was better in group 1 and group 2. Understood? Yes or no?
Repeat, ma'am.
Everyone
ma'am.
understood? Not understood
No,
or
ma'am.
under?
No,
Yes,
ma'am.
ma'am.
Repeat it.
See, you have two group of subjects. Okay, one first group you have given Medic A, second group you have given a medication B. Understood till here what we have done in the parallel study, right? Understood till here? Yes or no?
Yes, ma'am.
Yes.
Yes. After certain period of time, there will be no medication given. Means their medication will stop. This is called washout period. Okay. Now, after the washout period, the group 1 who received medication A will receive medication B, and group B who received medication B will receive medication A. Okay. Now, why this washout period is there? Because we don't want carryover effect of A on B and B on A. Okay. Then only you will be able to identify now what was the result of A and what is the result of B. You can compare them, right? And similarly in the second group. Okay, so it is a best way to analyze in the same group how the drug is acting. Okay, now understood?
Yes, ma'am.
Yes. Yes, ma'am.
Everyone?
Yes, ma'am.
Okay.
Yes, ma'am.
See, even you can go back home. I will give everything. You just revise it. Okay. If you don't still you feel any difficulty, then we can discuss in the next class also. Okay. Mhm. I don't know what happened to my laptop. Just wait. Okay. Okay, so the same explanation is given over here. There will be a switch off, like each participant will get both the treatment being tested. Some participants are assigned at a random to receive drug A, later drug B, otherwise they will receive B, then other A. To produce the valid result, the effect of that first drug must end before the second drug. So we have a washout period, okay, is taken and vice versa. A crossover design is a repeated measure design such that each experimental unit receive different treatment during the different time period. The patients are crossover from one treatment to another during this course of a trial. Now in this in crossover also they have like a different things they have. So this is a basic idea of what we do in the crossover. Okay, how much the drug will be there, that much the washout period will be there, right? Then we have a factorial design. So the simple factor we will take 2 into 2 factor. So this also I will explain you with the help of diagram. Okay, just wait. See, in interview, nobody will ask you about the design. Okay. But you should have a basic understanding ki what are the randomized clinical control trial, what are non-randomized, what are observation study. Okay, this will have a like a better picture. You will be able to understand, like you will do the clinical data management, okay, or you do the pharmacovigilance. This all thing will help you out over there. Okay, so next is your factorial design. So most of you are from the biotech background, so you might have studied in your this bioinformatics, okay, or statistics. You have been there. Biostatistics is there in that syllabus, right? So you might be familiar
Yes,
with
ma'am.
certain terms. You might be familiar with certain terms.
Yes, ma'am.
Okay. So it is just a revision, whatever we have studied. Okay. So next is your factorial design. So in factorial design, what happens? Suppose same sample size we will take of 100 population. Now we have suppose two drug we have. Okay, like now the condition is what? every group should be in the randomization. Every group should have an equal number of participants. First condition is that. Okay. So out of 100, like we have made a four groups, 25, 25 each in every group, right? First group will receive both the drugs. Like it might be in the combination. Okay. So A plus B, both the drugs we will give it to the subjects in first group. Second group, we will give A drug and only A drug will give and placebo B will give. Okay. In second group, we will be give only drug B and placebo of A. In fourth group, both the placebos we will give of A and B. Now here we will be able to identify what will be the placebo effect, what will be happen if only B drug is given, what will happen only A drug is being given, what will happen if both the drug is given in the combination. Okay, so factorial designs are done into the factors. Any question till here?
No, ma'am.
Everyone, just answer me. Any confusion you have, anything you want to ask, you can ask. Hello. Yes, everyone understood what is factorial design?
Yes, ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, okay, fine. So for the more detail, we have everything written over here. You can just go through this and just refer the this diagram, so you will understand more. Okay. In biostatistics, we have this agricultural products there, right? People are there from biotech, I guess, in this class. Yes or no?
Yes, ma'am.
So there that time we used to take agricultural product. Okay, in this field we have done this, in this field we have done that, and we have to compare. There is also a washout period in that. Chalo, coming back to the topic. Now, purpose of control group. So whenever we study, we have I have told you about the control, why we give the control to check. So control is basically, you can say, a benchmark, or we have to check how much the disease is being cured when we give a drug to any patients. Okay, so we have a different controls. Like it could be your standard drug can act as a control, right? Or placebo can act as a control. So placebo is what, you are not giving any medication, you are just seeing ki how much after giving the drug what will be the effect on the patient. So that will be a control. And you have a historical control. Historical control is what, we refer the previous analyzed data, based on that we analyze the current data. That becomes your historical control. Or we have a concurrent control. Concurrent means different dose regime, we check what is the effect of a drug. Like suppose we are giving 10 mg to a certain patient, after to few we are giving 20 mg, and then we can check the effect of a drug. This is called concurrent. Or to the same patient only, you can give a 10 mg, and after a certain period of 20 mg you can increase. Okay, so these are the patterns, or these are the control group we refer for our reference. Okay, okay, how we are taking the control, what control we are taking, and we have to design according to that. So type of control: external control, historical, and concurrent. Concurrent means one after other. Okay, historical means taking the historical data, taking the historical study, and based on, you are analyzing the current data. That becomes a historical. Okay, so previous data become your historical, it becomes a historical control. Concurrent means one after another. So suppose you have given 100 mg to some other, you have given 250 mg, and then you can see the difference. We have placebos. Okay, placebo is given to few patients, and few patients are being, like in parallel. We have given a placebo, and to other group we have given a standard drug, or we have given a test drug, and we can check the difference. How much time it take patient to cure the disease. Okay. We have active control. So active control could be like any standard drug we can compare with this with the current drug, or two standard drug can be compared. Yes, which is better, even though they have a different ingredients. Okay, but they have a similar effect. So we can compare, yes, which is better. Multiples of active and placebo. So as we have seen in the this pictorial design, the active and placebo, everything was there in that. So that one becomes your active, yeah, one becomes your standard drug, and one becomes your placebo. Based on that, you can analyze the data. Okay. After giving active drug, what is the benefit? If I give some patient placebo, what is the effect? You can analyze on that terms. Okay. Understood control groups?
Yes,
Yes.
ma'am.
Okay.
Yes, ma'am.
Yes,
So
ma'am.
clinical trial greatest enemy is bias. So you should not be any bias to remove. You should not have any biasness in the clinical trial. For that, we should have, based upon your number of population, we should have an equivalent of number of group. Okay? Like in factorial design, 100 patients are there, so we have to form a equivalent number of group among them. Okay, whether it is parallel study or whether it is a crossover study, so group should be in the equal number. Okay, it should be randomized, not no favorism should be there. You know, these people will only go to the test drug, this will only go for the standard drug. Okay, it should be random allocation of the subject should be there in the group. Then standardize the outcome should be is like whenever we make a protocol we have studied, there is only two outcomes. Okay, primary and outcomes or primary endpoints or secondary endpoints. So we have to standardize कि every patient we have to take their parameter and we have to study that. Okay, then there should be a we have to try, yes, it should be like you are doing phase 3 trial, so it should be blinded. Okay, sometime it is unblinded, but most of the time we have to make a study blind to to standardize the outcome, or you can say standardize the result. We need to do the blinding of the study. So blinding means people are assigned at a random either to receive a new drug or the standard or a non-functional substitute. Okay, it depends upon that. Non-functional substitute means placebo. Many phase 3 trial are randomized and double blind in the trial because number of subjects are more in that study. Okay. Open trial. So open trial or open label means there is no blinding in the study. Okay. So both the doctors as well as participants they know what treatment are being they are given. Okay. Like some trials of surgical products or some medical devices. So it is like open trial. Okay. They know okay, what are the surgical procedures. This is a new surgical procedure. So doctors know, participants know. Okay. Comparison of a medical devices, that also becomes an open trial, right? So blinding is no blinding or open label that all the patient know what treatment is being assigned and investigator also know. Single blind means patient does not know what treatment is being assigned to him, rest everyone know. Double blind, neither the participant nor the healthcare provider they know what treatment is being assigned to whom. Okay. Then we have triple blinding. So only physician know ki what treatment is being assigned to which patients. Okay. So physician, statistician, they don't know what treatment is being assigned to whom. Okay. Why this is done? Triple blinding. See, certain things are like when you do the research, okay, or we'll take a simple example. When we work in the lab in the college or school time, if we know ki what salt is there in which, okay, so or what we were doing the titration. Okay. Titration, we know that this will be the result. Pink color will come out and it will be getting disappear. Okay, after certain period of time or certain limit. Okay, the liquid will be pink, right? So we directly what we do? We set the everything into the base mark and we show it to the our assessor, right? So such thing should not be there in the trial. So we have to maintain some self-analysis part should not be done by the physician or statistician. So we have to maintain the triple blinding in the trial. Understood? Yes or no? Hello? What happened?
Yes, ma'am. Yes, ma'am. Understood.
बायस मीन्स खुशी कि यू हम उसको क्या बोल रहे हैं फेवर कर रहे हैं बायस आई थिंक दिस इज ओनली कॉल्ड इन हिंदी है राइट हम फेवर कर रहे हैं एक को है ना एक जैसे दो ग्रुप है हम बस अच्छा अच्छा अपने फेवरेट वालों को दे रहे हैं ओके और थोड़ा थोड़ा टेस्ट हम दूसरों को दे रहे हैं तो इट बिकम्स अ बायस राइट ओके खुशी Shubham, what are you asking? G means I don't understand.
No, ma'am. G means
Uh,
group, ma'am.
Acha, नहीं, G means you are asking G means what? Where have you seen that? Okay, so understood triple blinding, double blinding, single blinding?
Yes, ma'am.
Okay. Khushi,
Yes,
have
ma'am.
you understood? Khushi, have you understood?
Yes, ma'am.
Okay. Okay. Now to maintain a like in factorial design we have seen. Okay. So what happens? There are some double dummy designs. Okay. Double dummy means it should look exactly same as it is. Okay. As a treatment trial. Okay. To maintain a blinding, to maintain a methodology correct, we have to do this double dummy design. So a double dummy design is a technique for retaining the blind when administered supplies in a clinical trial when the treatment cannot be made identical. Okay, we have to administer certain supply or we have to design certain drug. It should look identical. Like supplies are prepared for the treatment A, active and placebo, and treatment B, active and placebo. Like we have taken in the factorial design, we have taken treatment A, treatment B, and placebo of A and placebo of B. Okay, subjects then take two set of treatment, either A active and B placebo, either A placebo or B active. Okay. Double dummy is a method of blinding where both treatment group may receive a placebo. Okay. For example, one group may receive treatment A and placebo of B. Okay. So it is similar in appearance. Okay. And other group would receive treatment of B and placebo of A. Okay. So it is like it is being designed like B will be in the tablet form and it will be in the capsule form, so that the other patient will think yes they are getting the same medication as I am. Okay, it will not affect their psychological belief. Okay, so we have to convert everything into the dummy. Either you can have a different color, but the substituent will be same, like liquid or pink color liquid, white color liquid, or you can say some tablets will be there, or other one it will be a capsule. Okay, such way you can design your dummy in the study. All right. So now next is your match pair trial design. So we have to in this we have to make two groups. Okay, we have to make pairs, and then each pair will be randomized into different group and they will receive treatment A and B. Here also they will receive treatment A or B. Suppose you have made a patient group of gender wise, suppose these are male and these are female. And now they will be randomly, they will be allocating based upon their similar character, they will be allocated into a different group. Or you have taken the same age group, okay? Some are there from the 18 to 25, some are from the 30 to 35. Okay, so you have to match their characteristics and you have to assign them into a different group, and then the similar group will receive treatment A and B, and this will receive treatment A and B. Okay, this is called match pair designs. Understood? So after screening, participants are matched into pairs. Within each pair, one participant is randomized onto treatment A, other will randomize to treatment B. This is called match pair. Okay, understood? Match pair. Yes.
Yes, ma'am.
Yes, ma'am.
Khushi understood?
Yes, ma'am.
Okay. Now Khushi's thought ki why I am being ma'am is always calling me. See, it is important for you. Okay, if you don't understand in any specific language you want, like in Hindi you want, so I can explain it. Okay. So now all the things I cannot explain in Hindi, but some of the things you will able to understand, right? Now withdrawal trials. So in a withdrawal trials, the participants receive a test treatment for a specified time and are then randomized to continue either the test treatment or the placebo withdrawal of active therapy. So we'll see with the help of diagram again. So suppose these are the patients. Okay. Now at a specific period of time, these both are receiving some treatment. Okay. Okay. At a specified period of time. Now after certain period of time, they will be like randomly they will be allocated into two groups. Okay. One group will continue to receive a treatment, other will continue to receive a placebo. Okay, so here we can find out that after stopping the drug, what is the effect on the patient. So it is called withdrawal, means we are withdrawing the drug from the patient system. Okay, so what could be the effect when the subject is not getting a drug and other how much it is creating a difference. The other is getting a drug and second one is getting only the placebo. Okay, so certain trial is called withdrawal trials. So during a withdrawal trial, after the first specified period of time has elapsed, participants are randomized into two groups. One will receive a placebo instead of continuing to receive an active treatment. Okay, this is called withdrawal trials. Okay,
Yes, ma'am.
okay. Next is your adaptive
Yes, ma'am.
clinical trial. Adaptive means you're adapting, or you can say flexible trial, you can say. Okay. Like whenever we study, suppose we are conducting pilot study or pivotal study. Okay. What we take a initial number of subjects. Okay. In the initial phase, we are check in the pilot ki how our trial is going to be happen. Okay. It is has a conditions in the protocol you can adapt to the trial design. Suppose you are conducting a trial, you are giving a test drug. Now there you will be identifying ki how much my drug is effective and how much it is being like what effect and how much it is safe enough. Okay, based on that, if you find ki, yes, it is giving very good therapeutic benefit. Okay, so you can increase the patient based on your study, or you can decrease the patient. Okay, or you can, if you want to change certain designs based on the initial results, you can change that. Okay, this is called adaptive trial design, which began to catch up with the clinical trial service providers. The idea was adapted, this was initiated in 1970s. Okay. So as the name suggests, we have seen, we have to adapt to the situation. Most of the investigators, they practice this type of design, adaptive trial. You can do the changes on the basis of the preliminary results. After 1 week of a treatment, you want to change certain designs. You can increase the patient, you can decrease the subject, you can change the design that we can do in this. Okay, based upon the initial results. Like after 10 dose, you find out, yes, there is an ADR being developed. Okay, so you have can change the methodology for the trial. You have to change some process. Okay, you can change that. So an adaptive design is a clinical trial design that allow the user to adapt or modify a trial during its progress based on the interim result. Interim means initial results without affecting the validity and integrity of the trial. This adaptation can be based on the internal or external information of the trial. Okay, because we collect the data, we know, okay, how the drug is performing, how it is better. Okay, we have to take the patient care is most important for the any this uh, investigator or the physician who is conducting the trial. Understood or not?
Yes, ma'am.
Yes,
Yes,
Okay.
ma'am.
yes,
So interim analysis is that same thing. In the interim means based upon the initial analysis. We have to stop or we have to continue with the further analysis we do based on that. Okay. Interim means initial results, initial data, initial results. We have to analyze whether that trial should be stopped. We have to continue with it, or we have to change some methodology or modification. Okay. So not thank you. We have observation design also. Okay. So next is your observational design. That is first is your cohort study. Okay. So cohort study means a prospective. Okay. Prospective means we have to see the future based upon the present. You have to analyze now based upon the future. the data, you have to predict the future, what could be the outcome. Okay, so it becomes your prospective design or cohort study. Okay, suppose we have taken a sample size and sample is size, and we have taken the exposed population as a smoker and non-smoker. Based upon that, you have to analyze in future these people, how many people got a lung cancer or disease, or how many people that do not got a disease. Here also, who are non-exposed or who are non-smoker, how out of this, how many have lung cancer and how many have do not have a lung cancer. Okay, so we have to like based upon the risk factor, based upon the exposure, you have to determine the risk factor associated with it. Okay, so it becomes your cohort study. So a population at risk for a disease event is followed over the time for the occurrence of a disease and event. This study used to estimate how often disease or life event happens at a certain population. These are the best method for determining the incident and the natural history of a conditions. Okay. So more we'll see how to calculate that. So suppose you have in the cohort you have taken 100 sample size, okay, like 100 people you are going to survey, okay, 100 sample people you have taken. Now out of this 60 are the smoker and 40 are the non-smoker. Okay. Now out of 60, 40 people develop lung cancer. Now this is the smoking condition is not that today you have smoked, so tomorrow you will get a lung cancer. It is not. You have to follow them over the time, like 5 year, 10 year. You have to follow this patient. Okay, it is just an example. So it depends upon the disease, what disease you are taking. Okay. So lung cancer, you have seen that after 10 years, out of 60, 40 people develop a lung cancer and 20 are non-disease. Similarly, here also, out of 140 are the non-smoker, but 3 develop a disease and 37 are the non-disease patient. Okay. Now what you will do, you will calculate the incident ratio. Okay. So the purpose of calculating incident ratio is that what are the chances to have an outcome of a particular disease. Okay. So smokers, we have seen disease one was 40, non-disease was 20. Here also disease one was non-smoker, but disease was 3 and non-disease was 37. Okay, you will get an incident rate, and that out of that you have to calculate the incident ratio. Okay, just see to it. If you don't understand, please let me know, or we will proceed further.
Understand, ma'am.
Understood, everyone?
Yes, ma'am. Understood.
Yes, ma'am.
Yes,
Okay,
ma'am.
okay. Okay. So next is your retrospective. Okay, this was a prospective. Retrospective means look at the medical event from past to present. Information is available immediately and difficult in tracing the subject and doubt on quality of records. So this is the kind of drawback. Yes, there could be a
Yes.
chances of confounding when we do the retrospective analysis. Retrospective means based upon your current data, you have to predict why this person got a disease. Okay, this also we'll see with the help of diagram. Great. Okay, so in this retrospective of case control study, we take like a disease I have taken as an outcome was a breast cancer. Okay, now one of the reason of this breast cancer is oral contraceptive. Okay, this was our expose rate we have taken. Okay, now population which we will be selecting, we have to select based upon their characteristics. Okay, certain characteristics. We have to take a female over here. One characteristic. Second will be 40 years or more. Okay. Third will be your socio-economic background. So everything should be equal when we do some survey kind of study in this. Okay. Now we have to see the past exposure. Okay, why these people develop a breast cancer. So this out of this disease, 100 patient was disease, but from this 80 were exposed, means 80 were consuming the oral contraceptive out of this, so that they have developed a cancer. And they have a disease, but they were non-exposed to oral contraceptive. Okay. Similarly, here, out of this non-disease, 100 were exposed to this oral contraceptive and 50 were non-exposed to oral contraceptive. Okay. Now, what you will do, you will find a odd ratio. So this is a disease one, and this was the exposure rate. Okay, so disease and exposed were 80, disease and non-exposed were 20. We have to do the cross multiplication of both. Okay. And you can find an odd ratio. So we will be able to identify yes, what are the chances or of having exposed with the particular disease. We are able to understand over here. Understood or not? Now problem is this, there could be an information biasness, okay, when we do such kind of analysis, because whatever the disease we are taking, we have to do the question based only you can analyze the population, okay. So based upon the information you can generate the data. So it is not every time very effective, okay. Understood or not? Odd ratio.
Yes, yes, ma'am.
Yes, ma'am.
Everyone? Okay, okay, okay.
Yes, ma'am.
Last is your cross-sectional study where we will be seeing the present data. Okay. So this also we will see with the help of diagram. So suppose you present data means immediately you will get a result, exposure and outcome you will get a same point. So it is very effective sometime. Okay. So we have to collect the data based upon the information, present information. So suppose again you are doing certain study for the lung cancer. So there you will take a smoker, non-smoker, and disease non-disease patient. Okay. Now you have to link it. So smokers where 100 were having exposed to smoking conditions. From them, 80% people develop a disease and 20% were non-disease. This from 100 population, 50 develop a disease and 50 are non-disease. Now our interest is what? Our interest is the disease and exposure and non-exposure. Okay, we non-disease will not be considering. Okay, we are only bothered about a disease one. Okay, so what we will do, we will see the prevalence. Okay, prevalence in exposed population. So exposed means out of 100, 80 were having a disease, and prevalence in non-exposed population were 100 and 50 were having a disease out of this. Okay, they were not non-smoker, but 50 developed a disease. They were smoker, but 80 were developed a disease. Now what you will do? You will do same. You will do the ratio will take out, and you will find a prevalence ratio out of it. Okay. So here we will be able to determine the prevalence of a disease in a particular populations. What will be the condition of exposure and develop a disease. Okay. Prevalence ratio you will be able to find out. Understood?
Yes.
Yes, ma'am.
Okay. So the prevalence of health outcome is a simple proportion of individual with the health outcome of a population. So don't look at to this chart. This will get more confused. Okay. Okay, so here we have completed with the observation, non-observation studies, observation and sorry, intervention studies. Okay, so just go back and revise everything. Okay, okay. Any doubt we will be discussing in the next class.
Yes, ma'am.
Yeah, I will give you the presentation. Just study this because you have to understand it. Okay, not from the exam point of view, but you whenever you work, so certain things will be there in your mind. Okay. So shall we wind up for today? It is too much maths today, right?
Yes, ma'am.
Okay. Just go back and revise everything, right? Okay, and have a nice day,
Thank you,
dear. Bye. Bye. Bye.
ma'am. Thank you, ma'am.
Thank you, ma'am.
Thank you. Thank you. Bye. Bye.